Here with Tina Slocum and Mallory Wilson. Both are midwives here at Guthrie Lawrence Hospital, and we are going to talk about midwives.
Yeah, absolutely.
Yeah. So, what exactly is the role of a midwife, and how does it differ from other healthcare providers in the childbirth process?
Yeah, so midwives are experts in all things women's health. So the main thing we do is deliver babies, but we also can take care of women from adolescence all the way through menopause. All aspects of their life and all aspects of women's health.
And what types of services do midwives offer besides childbirth?
We do a variety of obstetrics and gynecological care, mostly for well women. So those services include well women exams, screenings such as pap smears and mammograms, reproductive health, issues with menarche to menopause. So it would just depend on the patient's needs.
So for ideal candidates, who would be an ideal candidate for midwife care? And are there any situations where someone, like, it might not be appropriate for them?
Yeah, that's a great question. So if someone's not sure if they are good candidates, they can always call our office, and we have an amazing nurse navigator that guides them through that. Our ideal patient are low-risk patients. That's who midwives typically deal with. If people have healthcare problems that we cannot deal with, we have other doctors in the office that we can either work in collaboration with them, or they may have to take over care if something becomes too complicated.
It is good to note that our model right now is a shared model because we are limited in the amount of midwives that are available to the area. We work very closely with the obstetricians in our office, as well as the obstetricians that are over at the hospital to do a unified care. So if a midwife was on call today and an obstetric patient came in for the doctor, we would most likely attend to their needs as well, as long as they were not a high-risk patient. And vice versa, if we were not on that day or unavailable, then the obstetrician in our group would see our patient for a delivery.
How do you guys really work with other healthcare professionals to kind of ensure comprehensive care for your patients?
Well, that's a little bit different than what I was talking about. This is our shared model within our office, which is wonderful, like you're saying. So we do work with a group of different obstetricians and maternal fetal medicine doctors. But the comprehensive, to meet all of our patients' needs, we may very well send a referral to any specialty depending on what issue the patient is dealing with. So we refer to endocrinology, maternal fetal medicine. We work with anesthesiologists, lab technicians, doctors, nutritionists, diabetes educators to make sure that our patients' needs are met completely and holistically during their care.
And we do have a social worker in our office, which is really helpful. If there's any needs like transportation patients don't have, we can provide them that.
All right, well, thank you guys so much for joining me today, and I hope you guys have a great day.
Thank you so much. It's been wonderful.
Thanks so much.